Hello, this is a virtual pathology specimen of a case of anal hemorrhoids, and here we're looking at the cut surface of a polypoid lesion. Let's turn the specimen around, and this is the mucosal surface. So this lesion is covered by intact mucosa, and the abnormal area is best seen on this surface, where we can see a few dilated and tortuous blood vessels beneath the mucosa. Let's look at one other example. Here is another example, and again we can see the overlying mucosa and the polypoid configuration. And if we turn this around, we can appreciate the presence of these dilated blood vessels on the cut surface. If you look carefully at the blood vessels, you can see that within the blood vessels there are some paler areas admixed with the brown color of the blood, and this is because of thrombosis, where there is fibrin deposition in the whitish paler area. Usually where there is thrombosis in hemorrhoids, there will be associated pain. Let's learn a bit more about hemorrhoids. Hemorrhoids are a very common condition, and they are especially frequently seen in middle-aged to elderly adults. There is an equal gender predilection, and often causes would include constipation, which can lead to straining during bowel movements, and sometimes pregnancy. Hemorrhoids are classified according to their location, so they can be internal. This means that they are above the dentate line, and hence the overlying mucosa is colorectal type mucosa, so glandular mucosa. They can be external, which means that they are below the dentate line and hence covered by stratified squamous epithelium. And they can also be mixed internal-external hemorrhoids and straddle the dentate line. Clinically, these may be painless or painful, and usually there is a polypoid protrusion within the anal canal, and the pain can be associated with the location. For example, external hemorrhoids are innervated by somatic nerves, then there may be pain, or if hemorrhoids are thrombosed, or if there is an associated anal fissure, which is essentially a tear or a break in the anal mucosa. Sometimes there may be associated rectal bleeding during defecation and also prolapse of the anal tissue out of the anal canal. Grossly, as we saw, there are these polypoid mucosa-covered lesions, and on the cut surface we can usually see these dilated, very congested and tortuous blood vessels. You can access the fully interactive and labeled virtual pathology specimen, as well as these annotated pictures, in our free online pathology resource, Pathweb. Registration is free, and the link is in the video description. On microscopic examination, we would see this polypoid lesion covered by mucosa, which can be colorectal type, or it can be stratified squamous, keratinizing or non-keratinizing. And below the mucosa, we would see these very tortuous, dilated, congested vessels filled with blood. And sometimes we can see fibrin deposition, which is evidence of thrombosis. The stroma itself can be edematous, and there can be collagen fibers, as we see here, and sometimes also smooth muscle bundles. And occasionally there can be mucosal erosions, and these can then lead to bleeding. There is a separate video describing the microscopic features of hemorrhoids. Hence, in summary, hemorrhoids are a common condition, and they present as polypoid mucosal covered lesions which can arise above or below the dentate line, or can straddle the dentate line, and the underlying stroma often shows these dilated and congested blood vessels with or without thrombosis. This virtual specimen, which is fully labeled and annotated, can be found within our Virtual Pathology Museum in Pathweb. And as mentioned, as you scroll down, you can also see other useful information, for example, annotated gross and microscopic pictures. Thank you.